Clayton will go ahead and give the update on today's cases.
Good morning, everyone. We have 6 new positive cases. Of those 6, we have no one who was hospitalized, 0 hospitalization. Oh, sorry. We have 7 new cases, excuse me, none of whom were hospitalized. Of the individuals, 1 in Kingsbury, 1 in Lincoln, 4 in Minnehaha, 1 in Yankton. The age range of cases, we have 2 individuals in the 20 to 29 year age range, 2 individuals in the 40 to 49 year age range, 2 individuals in the 50 to 59 year age range, and 1 individual in the 70 to 79 year age range. 4 of the cases were male, 3 of them were female. This brings our total case count to 108 total positive cases. We have 12 individuals total that have been hospitalized throughout the entirety of their illness. We have 1 death, and we have 44 recovered individuals. Total tests that have been negative, 3,609 total negative tests. We are adding 2 new counties that have community spread. Today that includes Brown and Marshall counties. And did want to provide just a quick note that the totals that are reflected on the Department of Health website have been updated. We have 2 updates on individuals' county of residence. 1 individual was originally listed as Butte County, and they will be changed to Lawrence County. And 1 individual had been listed as Minnehaha County, and they will be changed to Yankton County.
With that, we'll take your questions. Remember to hit *6 to unmute, and then once you've asked your question, please mute your phone again.
Question for Dr. Clayton. Dr.
Michael,
Clayton,
hello, go ahead.
That is a cumulative total of individuals who have been hospitalized at any point in their infection. So the case count is 12 total individuals hospitalized.
Dr. Clayton, Troy Vandersen, KXLG in Watertown. Can you give us those counties again? You had some backfeed when you initially gave those to us.
Certainly. We have 1 individual in Kingsbury, 1 in Lincoln County, 4 in Minnehaha County, and 1 in Yankton County.
Thank you.
Dr. Clayton, this is Fran Carr with the West River Eagle newspaper in Eagle Butte. Can you hear me?
Yes, go for it.
I wonder if you could talk about your plans to expand hospital capacity and if you're working with the Indian Health Services to make plans on Cheyenne River.
This is Kim Alston-Rice, Secretary of Health. Thank you for that question. We are actively working with hospitals throughout the state, including IHS, to determine capacity and their ability to surge, provide more beds and more care. Part of that assessment that is ongoing right now includes staffing needs and equipment needs, in addition to physical facility space that is available in hospital and in alternative sites. So yes, that planning is ongoing, and IHS is a part of it.
Next question.
Great, thank you.
This is Jody Heemsker at Dakota Radio Group in Pierre. Once someone has recovered, is in that recovered category from COVID-19, do we know, should they be exposed? Are they able to get it again? I'm kind of thinking like, chicken pox, that kind of thing, where you supposedly don't get it again after you've had it once.
Yeah, the current knowledge of COVID-19 is still evolving. but it is believed that the immunity provided from the initial infection means that an individual does not develop the symptoms or does not develop disease again.
Thank you.
Troy Van Duzen, KXLG Radio in Watertown. This question is for the Secretary of Health, Kim. Kim, in the governor's conference this morning, she had mentioned that we're starting to see clinics in some of the smaller communities close. Is that a problem across the state?
That is not a problem. I think the governor was just trying to reiterate that we support our healthcare workers. We're trying to get them supplies to keep them safe. We had heard some reports yesterday of a couple of clinics closing and have been able to work on that even today and are ensuring that they're able to continue to serve patients in their area. I think you can appreciate that we want to make sure people are getting to the right level of care and, calling providers ahead of time so that they can be walked through, how to access health care, and that's what the governor was also supporting in the press conference this morning.
Okay, thank you.
This is Jackie Hendry with South Dakota Public Broadcasting. I've got a question for Secretary Molson-Risden.
Go ahead.
Secretary, I'm wondering if you can clarify for us what would trigger the declaration of a public health emergency as opposed to a state of emergency.
Thank you for that question. So a public health emergency, the benefit of, or the use of that is really for individual cases where individuals are not complying, they are known to be a carrier of a contagious disease and are not following guidance to protect themselves and others. And so a public health emergency would be declared in a situation such as that so that we can take action to ensure safety of that individual in their community. I think the governor's been on record very clearly explaining that the declaration of state emergency is appropriate for our state at this time due to the, the ability to work with our federal partners differently and activate different state resources. If we need to consider a public health emergency based on individual behavior in the state, then obviously we would consider that.
Any other questions?
People of the Forum News Service.
Hi. Go ahead from Forum News Service.
Hey, yeah, it's Jeremy from Forum News Service. Just a clarification or maybe an expansion on what the governor talked about this morning. In two parts. One, the supplies we received from the federal government. What were those supplies? And then on the testing side, could you expand on this new testing capacity she's talking about?
So this is Kim. So the recent, we've gotten a few different shipments now, including one very large one yesterday, and have another one in the process of being shipped. But we've just recently received, 143,000 surgery masks, 15,000 gowns, 1,400 face shields, and again, very appreciative of those shipments. They are helping us keep up with the current demand. Your second question was about the rapid testing. We are still assessing just what exactly that capacity might be. We have been told that we will receive 10 to 15 of these new testing platform and the needed supplies for that. So we're still assessing how those will be deployed and what capacity that will bring, but we are encouraged by that.
Any other questions?
Yes, good morning.
This is
Joseph Barkov from the Capitol Journal. I was just curious about can you guys use models to predict the peak and stuff? I was wondering, and because I know there's different models out there. Do you guys use what models do you use? And I understand that it's probably a conglomeration of a couple, but I was curious as to which ones you guys do use. Thank you.
So this is Dr. Clayton. So yeah, there are a lot of different models that are out there. You need to be cautious when you take a look at some of them. There are a lot of different assumptions, and you are correct that the Department of Health is using our own models to identify, what we're looking at in terms of the potential peak for this pandemic due to COVID-19, as well as, what might be needed for hospital surge capacity. It's worth noting that, there are a lot of different models out there, and, we're not tied to just one. We are looking at the assumptions underlying all of them as we kind of look to what is the best way to surge, both in terms of hospital capacity as well as what we might need to do around community mitigation.
When are you projecting peak for South Dakota?
The governor has shared that, so I'll repeat that for you. At this point, we are looking at the end of May, early June, and the governor's committed to sharing any updates as they come along. As Dr. Clayton indicated, we are working with several different models, and as we get new data, that helps inform that process.
This is Carlene Wild with Dakota. Dakota News Now. And I had sent an email about this earlier today just to try and get some clarification, but I had gotten some information about stockpiles of N95 masks distributed to counties during the avian flu outbreak. Are counties or are first responders seeing a shortage of PPE, and is this something that most counties would have available to them or not know about it, or do you know anything about that?
Well, this is Kim again. Obviously, making sure that healthcare providers have appropriate PPE is our top priority. We do have a cache at the statewide level, so we have been able to keep up with requests to ensure that healthcare and first responders and EMS across the state, have what they need. To the degree there are supplies in communities, counties are able to distribute those as well, and so there's no state restriction on them getting PPE out to their priority populations.
We have time for one more question.
Hi, this is Joe Sneevy with Argus Leader. Can you talk about the cost of testing, what goes into it, how those costs are recovered?
So costs are not assessed, so there are no fees associated with the cost of testing to the patient. We have support through our federal partners through grant funding that is covering the cost at the State Public Health Lab. You would need to direct your question to the healthcare systems to get more information about how they're funding tests, but again, tests should be provided to patients at no cost to them.